Currently, I serve as a chief clinician at National, and basically I oversee everything that pertains with clinic, anything from clinical schedule for observers, as well as managing dispensary, and also my primary job is actually to supervise in the clinic for students. Well, first I like to interact with students, and students actually give me a lot of energy, and I try to do the same thing to the students. I try to give them a lot of energy, and this is actually a mutual learning experience. The education is focused on clinical experience. So students, they are submerged or immersed in clinical experience from early in their education. So for example, from trimester 2, students start observing. So while they observe, they also take classes. So they can integrate clinical experience into their didactic classes. All clinicians at National University emphasize students how to make an accurate diagnosis based on the key symptoms the patients present. So it will prepare them to be a successful practitioner when they graduate from the school. For example, if somebody came in with a common cold, there are different pathologies of common cold. Some people get it during cold winter days. Some people actually get common cold during hot summer days. Now, in those two cases, it cannot be the same pathology. They have different pathogens, and I teach students what to look for. What are the key symptoms they can pick and choose before they make a diagnosis. And we cover a lot of different disorders. Our education in the U.S., especially at National, is more traditional in terms of approach of Oriental medicine than in China themselves. And not only we are traditional in the classroom, but we are actually also very incorporative or integrating with Western science, especially in the clinical experience at National University. But our graduates have one of the best test scores, national licensing scores, despite a short history. And I can say that our graduates are one of the best prepared when they graduate from school. And I have seen some very successful practitioners after they graduate from school. And I'm proud to say that we are able to train them very well.